ever-evolving world of infectious diseases, finding effective treatment options is paramount. One such option that has gained prominence is Doxycycline Hyclate. From its humble beginnings as an antibiotic, this versatile medication has proven effective in combating a wide range of infections. With its broad spectrum of activity, Doxycycline Hyclate has become a go-to treatment for ailments such as respiratory tract infections, urinary tract infections, and even acne. This wonder drug works by inhibiting the growth of bacteria and reducing inflammation, helping to alleviate symptoms and promote healing. In this video, we will delve into the common uses of Doxycycline Hyclate in infectious diseases. We will explore its mechanism of action, dosing guidelines, and potential side effects. Additionally, we will discuss the importance of proper usage and potential drug interactions to ensure patient safety. Stay tuned as we navigate the fascinating world of Doxycycline Hyclate, uncovering its ability to combat infections and improve patient outcomes. Common infectious diseases treated with Doxycycline Hyclate. Doxycycline Hyclate is widely used in the treatment of various infectious diseases due to its effectiveness against a broad range of bacteria. One common use is in the management of respiratory tract infections, including pneumonia, bronchitis, and sinusitis. The drug's ability to penetrate deep into lung tissue and target bacterial growth makes it an ideal choice for these conditions. Another area where Doxycycline Hyclate shines is in the treatment of urinary tract infections, UTIs. UTIs are often caused by bacteria such as Escherichia coli, and Doxycycline Hyclate's bacteriostatic action helps to inhibit their growth and reduce inflammation in the urinary tract. This makes it an effective choice for both uncomplicated and complicated UTIs. Beyond respiratory and urinary tract infections, Doxycycline Hyclate is also utilized in the management of sexually transmitted infections, STIs, such as chlamydia and gonorrhea. Its ability to target these bacterial infections makes it a first-line treatment option recommended by healthcare professionals. In addition to these common uses, Doxycycline Hyclate is effective in treating skin and soft tissue infections, such as cellulitis and abscesses. Its efficacy against various bacteria, including Staphylococcus aureus, makes it a valuable tool in combating these types of infections. Overall, Doxycycline Hyclate is a versatile drug that offers a wide range of applications in the management of infectious diseases. Its broad spectrum of activity and ability to penetrate tissues make it a go-to choice for healthcare professionals. Understanding the mechanism of action of Doxycycline Hyclate. To fully grasp the effectiveness of Doxycycline Hyclate, it is important to understand its mechanism of action. This medication belongs to the tetracycline antibiotic class and works by inhibiting bacterial protein synthesis. By binding to the 30S ribosomal subunit, it prevents the attachment of aminoacyl tRNA to the mRNA ribosome complex, ultimately leading to the inhibition of protein synthesis in bacteria. Doxycycline Hyclate's ability to inhibit protein synthesis is not only effective against gram-positive and gram-negative bacteria, but also against other microorganisms such as Rickettsia, chlamydia, and mycoplasma. This broad-spectrum activity allows for the treatment of various infectious diseases caused by these organisms. Furthermore, Doxycycline Hyclate possesses anti-inflammatory properties that contribute to its effectiveness. It inhibits the production of certain enzymes involved in the inflammatory response, thereby reducing inflammation and promoting healing in infected tissues. The combination of its bacteriostatic action and anti-inflammatory properties makes Doxycycline Hyclate a powerful weapon against infectious diseases. It not only targets the bacteria causing the infection, but also aids in reducing symptoms and promoting faster recovery. Dosage and administration guidelines for Doxycycline Hyclate. Proper dosage and administration play a crucial role in maximizing the effectiveness of Doxycycline Hyclate treatment while minimizing the risk of side effects. The dosage may vary depending on the specific infection being treated, the severity of the condition, and the patient's age and weight. For adults, the usual dosage range for most infections is 100 to 200 mg of Doxycycline Hyclate per day, divided into 2 doses. However, in more severe cases, a higher dosage may be necessary, with a maximum daily dose of 300 mg. In pediatric patients, the dosage is typically calculated based on body weight. The recommended dosage for children is 2 to 4 mg/kg per day, divided into 2 doses. It is crucial to consult a healthcare professional for accurate dosing recommendations for pediatric patients. Doxycycline Hyclate should be taken with a full glass of water to prevent esophageal irritation and should not be taken right before bedtime to avoid the risk of esophageal ulceration. It is generally recommended to take the medication on an empty stomach, as food can interfere with its absorption. However, if gastrointestinal upset occurs, taking doxycycline hyclate with food may help alleviate these symptoms. It is important to complete the full course of treatment prescribed by the healthcare professional, even if symptoms improve before the treatment period ends. Stopping treatment prematurely can lead to incomplete eradication of the infection and potential relapse. Potential side effects and precautions of doxycycline hyclate. Like any medication, doxycycline hyclate may cause side effects in some individuals. The most common side effects include gastrointestinal disturbances such as nausea, vomiting, and diarrhea. These symptoms are usually mild and can be managed by taking the medication with food or a full glass of water. Other potential side effects include photosensitivity, which can make the skin more prone to sunburn. It is advisable to use sun protection measures, such as sunscreen and protective clothing, while taking doxycycline hyclate. Additionally, the medication may cause yeast infections in some individuals, particularly in women. In rare cases, more serious side effects may occur, such as severe allergic reactions, liver toxicity, or kidney damage. If any unusual or severe symptoms occur, it is important to seek immediate medical attention. Doxycycline hyclate should be used with caution in individuals with certain medical conditions, such as liver or kidney impairment, as dosage adjustments may be required. It is also important to disclose any other medications or supplements being taken to avoid potential drug interactions. Pregnant women, breastfeeding mothers, and children under the age of 8 should generally avoid the use of doxycycline hyclate, as it can cause permanent discoloration of developing teeth and affect bone growth. Drug interactions with doxycycline hyclate. As with any medication, doxycycline hyclate can interact with other drugs, potentially altering their effectiveness or increasing the risk of side effects. It is important to inform healthcare professionals about all medications, including over-the-counter drugs, herbal supplements, and vitamins being taken concurrently. Certain medications can reduce the absorption of doxycycline hyclate, such as antacids containing aluminum, calcium, or magnesium, as well as iron supplements. These should be taken at least 2 hours before or after taking doxycycline hyclate. Additionally, medications that induce liver enzymes, such as rifampin, phenytoin, and carbamazepine, can increase the metabolism of doxycycline hyclate, potentially reducing its effectiveness. On the other hand, drugs that inhibit liver enzymes, such as ketoconazole and fluconazole, can increase the concentration of doxycycline hyclate in the body, leading to an increased risk of side effects. It is crucial to consult a healthcare professional or pharmacist for a comprehensive review of potential drug interactions before starting doxycycline hyclate treatment. Comparing doxycycline hyclate with other antibiotics. In the vast world of antibiotics, doxycycline hyclate stands out for its broad spectrum of activity and versatility. Compared to other antibiotics such as penicillin or cephalosporins, doxycycline hyclate offers advantages in terms of its ability to penetrate tissues and its effectiveness against a wide range of bacteria. Penicillin and cephalosporins are more effective against gram-positive bacteria, but may not provide sufficient coverage against gram-negative bacteria or atypical organisms. Doxycycline hyclate, on the other hand, is effective against both gram-positive and gram-negative bacteria, as well as other microorganisms like Rickettsia and chlamydia. Furthermore, doxycycline hyclate's ability to inhibit protein synthesis gives it an advantage over antibiotics that target cell wall synthesis, as some bacteria have developed resistance mechanisms against cell wall targeting drugs. This makes doxycycline hyclate a valuable alternative in cases where resistance to other antibiotics is a concern. However, it is important to note that each antibiotic has its own specific indications and considerations. The choice of antibiotics should be based on the type of infection, susceptibility testing, and individual patient factors. Healthcare professionals should carefully evaluate the benefits and risks of each antibiotic before making a treatment decision. Frequently asked questions about doxycycline hyclate. Can doxycycline hyclate be used to treat viral infections? No, doxycycline hyclate is not effective against viral infections. It is specifically designed to target bacterial infections. Can doxycycline hyclate be used during pregnancy? Doxycycline hyclate is generally not recommended during pregnancy, especially during the second and third trimesters, as it can affect fetal development and cause permanent discoloration of developing teeth. How long does it take for doxycycline hyclate to start working? The onset of action can vary depending on the infection being treated. Improvement in symptoms is typically seen within a few days, but it is important to complete the full course of treatment prescribed by the healthcare professional. Can doxycycline hyclate be taken with other medications? Doxycycline hyclate can interact with certain medications, so it is important to disclose all medications being taken to avoid potential drug interactions. Consulting a healthcare professional or pharmacist is recommended. What should I do if I miss a dose of doxycycline hyclate? If a dose is missed, it is important to take it as soon as possible. However, if it is close to the time for the next scheduled dose, it is advisable to skip the missed dose and continue with the regular dosing schedule. Tips for maximizing the effectiveness of doxycycline hyclate treatment. To ensure the maximum effectiveness of doxycycline hyclate treatment, it is important to follow these tips. Take the medication as prescribed by the healthcare professional and complete the full course of treatment, even if symptoms improve before the treatment period ends. Take doxycycline hyclate with a full glass of water and avoid lying down immediately after taking it to prevent esophageal irritation. Take the medication on an empty stomach, unless gastrointestinal upset occurs. In such cases, taking it with food may help alleviate symptoms. Use sun protection measures such as sunscreen and protective clothing, as doxycycline hyclate can increase sensitivity to sunlight. Avoid taking antacids or iron supplements within 2 hours before or after taking doxycycline hyclate, as they can reduce its absorption. Consult a healthcare professional or pharmacist before starting any new medications or supplements to avoid potential drug interactions. By following these tips, patients can optimize the effectiveness of doxycycline hyclate treatment and ensure the best possible outcomes. Conclusion: the role of doxycycline hyclate in infectious disease management. Doxycycline hyclate has emerged as a valuable tool in the management of infectious diseases. Its broad spectrum of activity, ability to penetrate tissues, and anti-inflammatory properties make it a versatile and effective treatment option. From respiratory tract infections to urinary tract infections, and even sexually transmitted infections, doxycycline hyclate has proven its efficacy in combating a wide range of bacterial infections. Additionally, its use in skin and soft tissue infections further highlights its versatility. Understanding the mechanism of action, proper dosing guidelines, and potential side effects are essential for healthcare professionals and patients alike. By adhering to the recommended dosage and administration guidelines, patients can maximize the effectiveness of treatment and minimize the risk of side effects. While doxycycline hyclate offers numerous advantages, it is important to consider individual patient factors, susceptibility testing, and potential drug interactions when selecting the appropriate antibiotic for infectious disease management. In conclusion, doxycycline hyclate has become an invaluable asset in the fight against infectious diseases. Its ability to target bacteria, reduce inflammation, and promote healing makes it a reliable treatment option for healthcare professionals and a source of relief for patients worldwide. Thanks for watching.